everyone, Dr. Callanan here. Today I want to go through the results that I just received back from a client's GIMAP report. This is a DNA stool test that looks at so many different markers that you're going to see in a second. If you're hopping on here live, can you let me know how the audio is? Let me know that you can hear me, that you can see me. I'm going to be sharing my screen in a second so we can walk through the reports. If you are new to my videos, my name is Dr. Brianne Callanan. I'm a naturopathic doctor, and I help individuals optimize their gut and balance their hormones. And I am the creator of the Metabolic Reset Program, a program that helps reset your metabolism and lose 20 to 40 pounds in just 6 weeks. And today I'm going to be walking through the GIMAP results that I just got back. If you're a practitioner, functional medicine practitioner, naturopath, anyone who runs labs in their practice, recording a video of your clients' labs may be something that you could add to your business. So what I've been doing is I always review the client's labs before I see their follow-up appointment. And because I'm already spending the time reviewing them, I'm just walking them through on a recording about what the different markers mean in terms of their health. And this I will then send to the client. It adds an added value, it saves time. And then once they're on their follow-up appointment, we can discuss the action plan. So if you are looking to grow and scale your business and trade less time so that you can have more balance, this is something that you should consider doing. You can either work that cost into the cost of the lab, or you can just price accordingly for that. And it really does add added value. And it's something that they can review over and over again so that they know why they're taking what they're taking, and it improves compliance. If you are looking for more business strategy tips, if you're a practitioner, I would highly encourage you to check out the Designs for Health Mastermind that's coming up on October 18th in Toronto. All of the details are posted on the designsforhealth.ca website. It was my favorite event of last year, and you also do get access to the Archangel event that's the next day. So I would highly encourage you to check that out as well. I can't see the comments on here. Okay, let me know. I can see the comments now. Let me know if you can hear this so that I can make sure that you're getting the value as I'm speaking. Just wait for like thumbs up, anything. Let me know that you guys can hear me. Okay, while I'm waiting for that, I will share my screen. If I can figure out how to do that. Perfect. Okay, so this is what the GIMAP test looks like. It's a really easy test to do. You can complete it at home. Essentially, we just need a small little stool sample. You ship it back, and then we would get the results. So I love this test because it looks at so many different markers, everything from bacteria, parasites, viruses, as well as digestive function. So the first thing that we see on the very first page, these are all the pathogens. These are the ones that will cause signs and symptoms in the majority of the people. And the first thing that we're seeing come up here is C. difficile toxin A and B. Now, these are the toxic genes. This is not the toxins themselves. And we do know that 2 to 10% of the population can be carriers, and they often are asymptomatic. So this is not something that necessarily needs to be treated, and something that you really need to understand if you're interpreting these lab results, that these are the genes for the toxins, not the toxins directly. So if asymptomatic, don't necessarily need to be treated. These genes are likely not turned on. And it's still, if you have these toxins present, important to avoid antibiotics when they are not necessary, which is key. When they're necessary, absolutely. When they're not necessarily, consider avoiding them and use something that is herbal for antimicrobial, because if you have these toxins present, you're more likely to develop the negative consequences of C. difficile after antibiotics. Okay, so parasitic pathogens, those were all clear. Viral pathogens, those were clear, which is amazing. So the first page looked really good. The next page, we are looking at H. pylori. So H. pylori is a bacterium that is often present in people, and they are completely asymptomatic. So this, again, it's really important. If you are displaying symptoms, then you treat. If not, you could be an asymptomatic carrier. Now, the issue with H. pylori is it can cause inflammation, it can cause significant bloating, as well as stomach ulcers and peptic ulcers and gastric cancer, duodenal ulcers as well, depending on the types of strains. Now, I love this test because it not only shows that H. pylori in this client is present, but it shows the virulence factors. And what this means is how pathogenic is this particular type of H. pylori, which is how likely is it to be causing signs and symptoms. So we have the BABA-A virulence factor present, which this makes the bacteria more adhesive, so it's more likely to cause long-term infections opposed to the acute short-term infections. It also induces inflammation. So when I'm seeing multiple virulence factors elevated or red or positive, H. pylori is also positive, and someone's displaying signs and symptoms, this is where we really want to treat it. So you might have burning, bloating, pain in the upper abdomen. And what you can consider doing is DGL, masticum, methylmethionine, vitamin C, zinc carnosine, or berberine. And these are common ingredients that you can find in something like a Gastromend or the Berbavail. So definitely wanting to look at H. pylori and treating it specifically in this client because they were displaying symptoms as well. Now, this is where it gets really cool. This is where we're looking at the normal bacteria flora. So is a probiotic right for everyone? Not necessarily. Most multi-strain probiotics are containing lactobacillus and bifidobacterium. And if you look at this client, the bifidobacterium and the lactobacillus are within normal healthy ranges. So if I was choosing a probiotic, it probably wouldn't be one with bifido and lactobacillus because those levels are fine. Where we're seeing higher levels of the Prosnitsky, this is a main Clostridia class of bacteria. This bacteria produces butyrate, and butyrate is the fuel cells for the intestinal cells. So the bacteria produce the butyrate to feed the intestinal cells. It's a really great symbiotic relationship. Now, we want butyrate. Butyrate is helpful. Now we have to look at, okay, why could this be high? When Prosnitsky is high, it's often a compensatory mechanism. So this promotes anti-inflammatory processes. So there's something going on in this client's immune system, something going on in the gut that's creating inflammation, and then the Prosnitsky is being elevated. So that's something we need to look at the rest of the pages to see what's going on, what's creating the inflammation. Is it food sensitivities? Is it overgrowth of certain bacteria, which we'll see a little bit lower down. Now, interestingly enough, Escherichia species, they are normally present in our gut and they are non-pathogenic, meaning they don't cause signs and symptoms. You want a robust level of the healthy Escherichia because if you don't, then the pathogenic strains of the E. coli can grow. So if someone is experiencing a lot of E. coli-based infections, maybe UTIs, you might want to optimize this here to prevent that from occurring. If they're not experiencing that, then this is not something that you necessarily need to treat. Low levels can also indicate reduced mucosal health. So we want to look at, okay, overall, what is the health of the gastric mucosa? Why are we seeing these changes? But the main take home from here is that a bifido or a lactobacillus probiotic is not necessarily needed in this person at this time. Then when we're looking at phyla is just classifications. So the same way we have animals and then they can be broken down, for instance, into dog and cat, and then there's a whole bunch of different species of dog or cat. That's the same with the Bacteroides and Firmicutes classes. Then there's a whole bunch of different strains that either fall into the gram-negative Bacteroides or the gram-positive Firmicutes. And where I'm looking at this from a clinical standpoint, because I treat a lot of weight loss in my practice, is I want this Firmicutes bacteriocytes ratio less than 0.5. I know normal is less than 1, but I aim for less than 0.5 because when we see a elevation in the Firmicutes and lower levels of Bacteroides, you are more likely to extract more calories from food, more fat deposition, lipogenesis, which just means the development of fat cells, impaired insulin sensitivity. So when you eat carbohydrates, you don't have as great of a normal response. Insulin sensitivity, essentially, your cells stop responding to insulin and then insulin levels rise, creating more insulin resistance as well as risk for prediabetes, etc. So what we want to do here is we want to focus on optimizing the Firmicutes bacteriocytes ratio if they're looking for weight loss in general. So that's something that's really interesting. There has been studies done on rats where they take the feces from an obese rat, transfer it into a lean rat, and then that lean rat actually becomes obese regardless of the food intake and dietary. They kept that consistent. So we do know that our gut bacteria influence our weight by influencing our hormones, estrogen recycling, etc. So it's something to consider as well. The next page here is looking at opportunistic bacteria. So these are bacteria that are normally present in low amounts, but given the opportunity, they can overgrow. Now we are seeing, bacillus creep up here, but it's still within normal range. The methanobacteria, these are bacteria-like microbes that produce methane. This can cause a lot of bloating, constipation, as well as we see this elevated in those with IBS or SIBO, small intestine bacterial overgrowth. Same with these other ones that are starting to creep up. We're thinking inflammation, there could be cramping, there could be constipation, but there could also be loose stool. So you really have to do a history as well as look at these results and see where the patient is at or the client is at. But definitely for this person, I want to look at reducing the overgrowth of these normal bacteria. Now, why are these bacteria growing? Well, it's not necessarily because they don't have enough healthy bacteria, because we looked at the normal bacteria flora. Overall, it was fine. So it's not a competition issue. We need to look at, okay, why are these growing? Is there not enough stomach acid to promote digestion? Is there inflammation and that's allowing this to grow? Is there food sensitivity? So there's so many different things that you need to address. So you kind of have to look at the whole picture here, but definitely doing something to reduce the overgrowth. Oil of oregano, garlic, something malty, antimicrobial like a GI microbe X at a high enough dose. I like to dose things higher so that clients can reduce the overgrowth really, really quickly so they feel better quicker. It's kind of the way I do it, go big. And looking at it overall, you definitely would want to combine something to support the overgrowth, support the H. pylori. In this client in particular, you wouldn't want to give HCl right away because of the H. pylori that is present. So you might want to do something like the gastromend first, then go into a GI microbax to kill off this overgrowth of bacteria. The gastromend does have some masticum, some antimicrobial. It wouldn't be as strong as the GI microbax, but you might want to do it in stages that way. This test also looks at potential autoimmune triggers. So it's not that if you have this bacterium, you will get XYZ autoimmune condition. We know that to develop autoimmunity, you need the right immune system impairments, you need the right environment, you need the genetic predisposition, and all those compounding together lead to the development of autoimmunity or the potential for the development. So just because Klebsiella here is high doesn't necessarily mean that you are going to go on to develop rheumatoid arthritis. Klebsiella and rheumatoid arthritis are associations. I do have a blog about different gut bacteria and where we are seeing higher levels of those and what autoimmune condition on my website. It is also in my book, Wild and Free, available on Amazon, so you guys can go check that out as well. Interestingly enough, about these higher levels of Klebsiella species, we can see diarrhea, gas, abdominal pain, bloating. And this one is really, really fascinating. It is the higher levels of histamine in the gut. So if someone is having autoimmune type symptoms as well as histamine type symptoms, or just histamine type symptoms in general, and you can't really figure it out with food, it might be because of the different bacterial strains that are present. And that needs to be addressed in order to reduce those histamine levels. Of course, you could do something like an antihistamine, quercetin plus nettles, histidao, but that I see as more of a short-term band-aid approach to break down the histamine. We really want to get to the root cause. And if the root cause is food, address that. If the root cause is these potential autoimmune triggers that are in the gut, address that then. Candida, fungi, and yeast were all normal, which is great. Viruses were normal, which is great as well. Parasites looking good, worms looking good. So that is really, really positive. We are just looking to address the overgrowth, potential SIBO, maybe constipation is leading to that potential overgrowth, wanting to support that. We want to address the H. pylori. Now, looking at the intestinal health, elastase is looking within the normal range. Personally, I like elastase over 500. This is pancreatic enzyme production. Are they breaking down their foods properly? Steatocrit is the amount of fat present in the stool. So are they breaking down their fats? This person looks like they have low levels of fat in their stool. Either they're eating the appropriate amount of fats in their diet for them, for their unique genetic makeup, or they have adequate levels of lipase and they're breaking down their fats adequately, which is really good. GI markers. So this beta glucuronidase, we don't want beta glucuronidase high because this may indicate dysbiosis, which we saw at the start with the overgrowth of the normal bacteria overgrowing to levels that we would not consider normal. But it also interferes with phase 2 detoxification. So if your phase 2 detoxification is impaired through this cycle, you're going to be recycling that estrogen. So you want to do things to support the liver, like milk thistle. Calcium D-glucarate in this case would be really, really awesome. Again, at therapeutic dosage is going to be really important. And this is where estrogen is being recycled. So if your estrogen is being recycled, even if you have healthy estrogen levels, you need to be cautious because the more estrogen we are having, especially the quote unquote bad estrogen, we are increasing our risk potentially for estrogen dependent cancers. You can test your estrogen and the ratio of your good to bad estrogens by using a urine test like the Dutch test. But this alone here, I would say definitely calcium D-glucarate, and make sure that you are optimizing that phase 1, phase 2, phase 3 detoxification pathways if you're on hormone replacement therapy. So if you're on hormone replacement therapy, you're taking more estrogen in and you're not able to detox that, then you're going to be at an even increased risk of estrogen-dependent cancers. So something to keep in mind. Fecal occult blood low, which is great. That's what we want. Secretory IgA is the immune system in the gut. So how is the immune system functioning? This is a really great result. So even though the immune system is functioning, we're not seeing that it's taking care of those overgrowth. It's not taking care of the H. pylori. So that's when we would intervene with a antimicrobial specific for those specific strains, as well as the H. pylori. Anti-gliadin IgA. So this is a marker of gluten sensitivity. Gliadin is the protein in gluten, and this measures the immune system response to it. So this is either the patient is on a gluten-free diet and they are not being cross-contaminated, they're doing really well, because you need to be eating the gluten in order to mount an immune response. So if this person's on a gluten-free diet, continue with it, you're doing great. It could also be if you notice a low anti-gliadin IgA level and they are experiencing signs and symptoms that you're really thinking it is a gluten sensitivity, it could be that they just don't have a strong enough immune system to mount those responses to measure the IgA. Now, we know in this patient it's not the case because their secretory IgA looks good, but that's something to consider on food sensitivity testing as well. If everything's coming back normal or low and it doesn't really make sense based off of the signs and symptoms, consider how robust the immune system is. Calprotectin, which is a measure of inflammation, is low, which is great. If I see elevated levels of inflammation, I'm thinking more IBD or inflammatory bowel disease. So it's nice to see that low. And zonulin here is a little bit high, not super high. I've seen 800,000 plus for zonulin levels, which is really, really high. And zonulin is a marker for leaky gut. So essentially, we want the cells of our intestines to be nice and close. We don't want undigested foods or proteins, bacteria getting through those tight junctions because we know that can trigger the immune response. So definitely start with making sure we're digesting our food from a rest and digest standpoint, maybe taking a digestive enzyme to help break down your foods, but also we want these tight junctions closed. So this person is showing increased permeability because of the elevated zonulin levels. After we take care of the H. pylori, we take care of the overgrowth, we take care of the beta glucuronidase because that's recycling estrogen, like a liver gut detox. Then what we would do is the last step is working on healing leaky gut. So something like glutamine, zinc carnosine, anything that's helping to seal those tight junctions up. I really like a product called GI Revive. I've seen amazing results with it, reducing zonulin levels, bloating, gas, constipation, multiple food sensitivities, works really, really well. So that's essentially the overview of the GI map. This is a video that I would record for the client that I ran this test on. I would send that over to them, not giving specific dosages or details on what we're going to do. I will save that for the follow-up, but it really streamlines the process, adds value, and then it's something that they can watch again and again. Compliance, I do find, improves dramatically when clients understand why they're taking what they're taking. So I hope that was helpful for you. If you have any questions on the GI map or about my clinical practice or about the DFH Mastermind that's coming up October 18th in Toronto, you do get access to the Archangel event, which is the next day. Both events were my favorite by far of the entire year. There's more business strategy tips as well as clinical aspects, so like how to grow your tribe and how to do a podcast and how to help with marketing to attract highly qualified leads to your practice, so that you are attracting the people that really want to work with you and that you can really help. So definitely check out those events. Any questions you have, let me know, and I will follow up on these comments because I didn't do that over the video. I hope you guys have an amazing Wednesday, and we will talk soon. Do I end the meeting or do I stop the live stream? That is the question. You guys might hang on with me for a little bit longer. So yeah, any questions that you guys have, post them, and I will definitely answer those in the next coming days.